Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Blood pressure medicines. Introduction. High blood pressure, also called hypertension, usually has no symptoms, but it can cause serious problems such as stroke, heart failure, heart attack, and kidney failure. Some people can control high blood pressure through healthy lifestyle habits, such as losing weight and reducing sodium in their diet. If lifestyle changes do not help you, your healthcare provider may prescribe medicines. This program explains blood pressure medicines. It explains what blood pressure is, the different types of blood pressure medicines, and possible side effects of those medicines. High blood pressure. Blood pressure is the force of blood as it presses against the walls of the arteries, like the pressure of water in a garden hose.
Two numbers are used to describe blood pressure. The top number, called systolic blood pressure, measures blood pressure when the heart pumps. Ideally, systolic blood pressure should be less than 120. The second number is lower than the systolic pressure and measures blood pressure when the heart rests. It is known as diastolic blood pressure. Ideally, diastolic blood pressure should be 80 or below.
For example, a patient may have a blood pressure of 125/70, typically pronounced 125/70. This means that the patient has a reading of 125 systolic and 70 diastolic blood pressure. Blood pressure varies all the time. Exercise or emotional stress can increase blood pressure. Increased blood pressure allows more blood to be pumped to the body. This helps the body cope with increased activity or stress. The body can tolerate a temporary rise in blood pressure. Because of these normal variations, a person is not diagnosed with high blood pressure unless repeated measurements show it to be consistently high.
High blood pressure is also known as hypertension. It is a common condition that affects billions of people around the world. Your healthcare provider can diagnose high blood pressure based on 2 or more in-office readings. A blood pressure reading of 120/80 is ideal. Anything above those numbers is considered high blood pressure. Elevated blood pressure is when your systolic readings are between 120 and 129 and your diastolic reading is less than 80. Stage 1 hypertension is more serious than elevated blood pressure. It happens when your systolic readings are between 130 and 139 or your diastolic readings are between 80 and 89. Stage 2 hypertension is more serious than Stage 1 and means that your systolic readings are at least 140 or your diastolic readings are at least 90. Hypertensive crisis is when your systolic readings are over 180 and or your diastolic readings are over 120. This is very serious. If you have it, you must see your healthcare provider right away.
Hypertension is also called the silent killer because it often has no symptoms. If it goes untreated for a long time, it can cause serious problems, including aneurysms, heart problems such as heart attack or heart failure, kidney failure, narrowed blood vessels, strokes, vision problems, including blindness. The exact causes of hypertension are not known. Though some people are at a higher risk of developing hypertension, anyone at any age and background can develop it. High blood pressure is a lifelong condition. Once it develops, it usually lasts the rest of the person's life, but treatments are available. Blood pressure medicines. Some people may need to take blood pressure medicines to control their high blood pressure. Often, 2 or more medicines work better than one. Blood pressure medicines work in different ways to lower blood pressure. These medicines may lower blood pressure by relaxing and widening blood vessels, removing extra fluid and salt from the body, slowing down the heartbeat. Types of medicines that relax and widen blood vessels include angiotensin-converting enzyme inhibitors, also called ACE inhibitors, angiotensin II receptor blockers, also called ARBs, calcium channel blockers, vasodilators. Any of these types of medicines may be used to lower blood pressure. Medicines that remove extra fluid and salt from the body are called diuretics. Removing extra fluid and salt from the body helps control blood pressure. Beta blockers are medicines that help slow down the heartbeat. They also reduce the amount of blood the heart pumps. This lowers blood pressure as well.
Other medicines that may be given include alpha blockers. These reduce the nerve impulses that tighten blood vessels. Alpha-beta blockers combine the nerve impulse reduction of alpha blockers with the heart rate reduction of beta blockers. Nervous system inhibitors. These control nerve impulses from the brain to relax blood vessels. Other medicines include aldosterone antagonists. These prevent too much salt and fluid retention, lowering blood pressure. Renin inhibitors work against the effects of renin. Renin increases blood pressure.
Your healthcare provider will help you decide which medicine or medicines will work best for you. You must take the medicine exactly as prescribed. It only works if you take it regularly. Never stop taking any medicine without first talking to your healthcare provider. Even after your blood pressure returns to normal, you may need to continue taking the medicine. Some people need to take blood pressure medicines for life.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Side effects. Like all medicines, blood pressure medicines can cause side effects. If your side effects are severe or bothersome, you may be able to change medicines. Some common side effects of blood pressure medicines are a dry cough or stuffy nose, cold hands and feet, constipation or diarrhea, dizziness, dry mouth or decreased sense of taste, headache, tiredness or sleepiness, weakness. Blood pressure medicines may also cause a skin rash, anemia, depression, fever, impotence, leg cramps or joint pains, nightmares or trouble sleeping. Tell your healthcare provider if you have any side effects from your blood pressure medicines. Some side effects may get better or go away after you have been on the medicine for a while. There are many medicines available to treat high blood pressure. If one or more medicines do not work or cause too many side effects, other medicines can be tried. Never stop taking a medicine without first talking to your healthcare provider. Some side effects may be more serious. Contact your healthcare provider right away if you experience chest pain, fainting, problems breathing or swallowing, slow or irregular heartbeat, sudden weight gain, swelling in the face, eyes, lips, tongue, or legs.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. High blood pressure, also called hypertension, usually has no symptoms, but it can cause serious problems such as stroke, heart failure, heart attack, and kidney failure. Some people can control high blood pressure through healthy lifestyle habits, such as losing weight and reducing sodium in their diet. If lifestyle changes do not help you, your healthcare provider may prescribe medicines. Blood pressure medicines work in different ways to lower blood pressure. These medicines may lower blood pressure by relaxing and widening blood vessels, removing extra fluid and salt from the body, slowing down the heartbeat. Often, 2 or more medicines work better than one. A person may need to take blood pressure medicines for life. Your healthcare provider can find 1 or more medicines that can help control your blood pressure. If you experience side effects, you may be able to change medicines.
Thank you for using Explain.